the Center for Global Safe Water here at Emory, Habitat for Humanity, the Task Force for Global Health, the Centers for Disease Control and Prevention, especially prevention in this case, and I would be remiss if I also didn't thank the Wallace Genetic Foundation, who are providing funding for the event. Let me just knock out a couple of logistical issues, and then I'll get to the real reason I'm up here, which is to introduce Dr. Gangarosa, who's going to kick off our event tonight. One thing that I wanted to note is that anybody, especially those of you watching online, can ask questions via a Twitter hashtag. So it's AskWash. Hashtag ASKWASH if you want to ask questions during the question and answer session. Those of you in the room can go, we have a few aisle mics in the room, so when it's time to answer questions, you can go to the aisle mics. Finally, I want to thank, in particular, the efforts of a very dedicated intern that we have at CARE, who really was behind pulling all of this together, keeping everybody on track. Sue Glure. Sue, if you're around, right here. Sue, stand up. Thank you very much. She organized everything. All right, now to introduce Dr. Gangarosa, who I feel very unworthy of introducing. So Dr. Gangarosa is an emeritus professor in the Department of Global Health here at Emory. He has a career that spanned over 50 years, and for reasons that will become apparent, he's really here representing both himself and his wife, Rose. They've made an enormous contribution to both the Center for Global Safe Water and the School of Public Health in general at Emory. I'm not going to go through the full list of places Dr. Gangarosa has worked because it's a very extensive list, but suffice it to say that he worked with the Walter Reed Army Institute of Research at the University of Maryland. At the Centers for Disease Control, he was chief of the Enteric Diseases Branch, director of the Epidemic Intelligence Service, and deputy director of the Bacterial Diseases Division. After his retirement there, he went on and served as the first dean establishing the School of Public Health at American University in Beirut. And he's received numerous awards and recognition, including the CDC's Medal of Excellence, which is their highest award for advancing the knowledge of epidemiology, etiology, pathogenesis, treatment, and control of enteric diseases. Along with his wife, Dr. Gangarosa has continued to be a moving force in the School of Public Health and the Center for Global Safe Water. They've endowed 2 chairs that focus on environmental health here at the Rollins School. And they also have provided a lot of the funding that the students here use to do their field practicums, which for the students in the audience, you know that that's a huge part of the education you're receiving here, and it makes it a very sort of different program than it would be otherwise. So thank you very much, and Dr. Gangarosa.
Thank you, Brooke. I am so impressed with the momentum of change. It was about 10 years ago when Christine and I assembled colleagues who had common interests in water and sanitation to explore what could be done to establish a center. We had 2 groups that met. We had one group that met 2 times. And I recall when I was wondering what to do from there, thank you. My colleague Stan Foster said that, Gene, without some funding, we're going nowhere. So Rose and I put our heads together and we said, let's provide the seed money. We provided the seed money for 1 chair, and we had in mind to fund a 2nd chair. I remember when Jeff Koplan was sitting across from me at an Emory event next to Rose, and he asked, I learned later from Rose, what did he ask you? And he asked Rose, what are your plans for funding the 2nd chair? And Rose said, that will occur after we are deceased. But the excitement of what has happened, Christine's momentum in putting together such a wonderful program, and the help that Jeff Koplan provided that enabled funding for other faculty has just made such a big difference. I could not be more happy to see what is happening. We still have a long way to go, but we have a momentum that is most gratifying. So Jeff Koplan, I'm supposed to introduce Jeff Koplan, but he's the one person who doesn't need any introduction. He's so well known. And what is so unique about his career that is different than most of us is that he has expertise in such a diverse area of really important public health problems, now happily water and sanitation, which is the beginning of quality of life, and it's most important for any intervention to have water and a toilet to start with. So Jeff, I'm just so pleased to know you and to have this opportunity to introduce you and to remind the group, or perhaps they don't know, that Jeff and I worked together on a historically important waterborne outbreak that affected a community at Crater Lake in 1975. And we learned a great deal from that. And Jeff and another colleague, Mark Rosenberg, put together a class exercise that is widely used now. I've used it for years. I've stopped using it in the last few years because I've lost my hearing, but it's still being used by others. And it is a remarkable story and a remarkable learning experience for students to realize how decision-making is made in public health, depending upon where you sit. Anyway, if you're interested, you can look that up and Google it on the Crater Lake outbreak. Jeff, thank you for all you've done.
Thanks, Gene. Gene said it depends where you sit. I always sit next to Rose whenever I get the opportunity to do that. And I'm going to do a reverse introduction to reintroduce Gene, in that he has all these scholarly attributes and all the his generosity, his really superb leadership in the areas he's worked in around the world. But I would be remiss if I didn't mention, I'd be remiss in my family, because my daughter wanted me to say that besides all this distinctive stuff, she thinks that Gene is the most lovable faculty member in the School of Public Health. Yeah. And I would second that. This conference, this seminar we're having, is highly appropriate for those of us interested in global health. I think WASH in many ways epitomizes all the features of global health that we care about into what global health has evolved. Global health targets social inequities, requires interdisciplinarity, demands true partnerships between countries with two-way flow of leadership and decision-making and two-way flow of information, deals with issues and challenges that transcend borders. And you can apply each one of those, and we will, into water, sanitation, and hygiene. Inequity. If you're poor, the likelihood of your having adequate potable water and sanitation is much more remote. And with that comes an impact on health, education, nutrition, infectious diseases, and many other things, all of which hinder development. Interdisciplinarity, whether it's hydrology, civil engineering, mechanical engineering, microbiology, epidemiology, political science, anthropology, economics, law, geography, climatology, environmental science, communication, health education, and I could go on and on and on, but every one of those has a key role and place to play in WASH and in solving its problems. Modern partnering, working as equals, working as a team across countries, each side making complementary contributions, having mutual respect. We have as much or more to learn from our partners as they from us. WASH epitomizes that. And transcends borders. There is as much a WASH problem in many parts of the American Southwest and in Georgia, in the Middle East and North China, in the South American Altiplano, throughout Africa and the Indian subcontinent. This is truly no issue for any of us to say that this is a global health challenge and problem. A popular theme in global health today is the value of and demand for innovation. It's a bit of a buzzword, like the digital wunderkinds invented being innovative, and no one was innovative before the digital age. But public health has a long history of innovation. Long before the incredible technical advances that permitted us to tweet the fascinating details of our daily routine, play Angry Birds at the supermarket checkout line, and settle pop culture disputes at the dinner table via Google, there were public health innovations for the past several centuries. Just a few of them. Many of them are very low tech, very simple, but completely changed health outcomes in this country and around the world. Fluoridation of drinking water, antisepsis and sterile environments, use of seat belts and airbags, aggressively taxing tobacco products. In order to eradicate smallpox, developing lyophilized, freeze-dried vaccine and bifurcated needles, removing lead from gasoline, and adequate ventilation in factories and other protective measures to be taken in the workplace. Some WASH advocates have argued that our approach doesn't represent a major global health effort, like HIV, AIDS, and polio eradication. So take some of the features of polio eradication. Close monitoring and measurement, a coordinated investment of billions of dollars with a long framework to get it done, persistence despite setbacks, multiple partners working closely together, a clear objective, and incorporate approaches and interventions as needed and on a local or global basis as appropriate. In preparation for today, I've been looking over many both newsletters and blog sites related to WASH, and there seems to be a diversity of opinions about these elements, which, if united in a common goal, and in some of these features of major public health global campaigns, might target things more appropriately and move them forward more rapidly. Hopefully the next stage of WASH will be a true global health effort with more of a coordinated, multi-organizational, multidisciplinary team using a strong scientific database, innovative approaches, and measurable objectives. But that's what we're going to hear about from our panel here today. So Jean was kind in saying I had some knowledge about some things, but really I'm a dilettante. We've got a group of experts here, so we look forward to hearing from them. We're going to ask some questions of all of them, and then hope that you'll all participate and ask more questions of them to come. You guys ready? You have prepared answers for your unknown questions? Good. And you all might keep in mind things that you would like to ask of them explicitly. Let me just say, you've got the biographies of our panelists in your book in some considerable detail, but just going down the line here, we have Lourdes Mindreau, who has very kindly joined us from Peru, where she's the program coordinator for the Water and Sanitation Program of CARE Peru. Her English is much better than my Spanish, but it'd be more comfortable for her to answer in Spanish, but we have a translator who's going to help with those. So very much appreciate her coming. Next is Rob Tokes, who is Deputy Director of the division at CDC that deals with enteric diseases, water, sanitation problems, and has been a distinguished contributor to the field with over 250 scientific publications over the last several years. David Addiss, who was also at CDC for a good chunk of his career and is now at the Task Force for Global Health, active in a wide range of health issues, tropical diseases, including lymphatic filariasis, and most recently has been director of the Children Without Worms program. Delighted to have David with us. And Christine Moe of the Emory faculty, where she is the Gangarosa professor of safe water and sanitation and director of Emory's Global Safe Water Institute. So we've got a great group. Let's stimulate some discussion. I'm going to have, just to kick off, what do you think that the most major advance we could make in either any of the WASH elements might be? Just briefly, what do you think if we could do one thing in the next year, 2, 5 years, what would it be that would make the most difference in our lives? Christine, you're right here, so maybe you start off.
So I get to kick it off. Thank you, Dr. Koplan, and thank you to CARE and all of the organizers of this event.
Is it loud enough back to you? I think you're going to have to get the microphone right.
Yes?
Yes.
Okay, and thank you, Dr. Gangarosa. So I think I'm going to answer that in a somewhat radical way and say, even though the flush toilet was a transformative technology in the Victorian era, and that sanitary sewers were a transformative technology for the John Snow era, that maybe the next step in sanitation is actually to get away from waterborne sewerage and to find new ways of dealing with human excreta and linking that to energy production or safe food production. So can we think of different ways to handle excreta, especially in cities, in complex urban environments? Because as you know, our population across the world is becoming increasingly urbanized. More people live in cities now than in rural areas. And cities, especially in developing countries, resource-poor areas, are complex, messy, crowded, difficult environments. And how are we going to provide safe sanitation and safe water to those populations? So my suggestion is looking for new ways to handle sanitation, especially in low-income urban settings.
Christine, would you like to segue from that? Do you have some opening comments you want to add to that as well?
I do, if this is a good time for that. Okay,
Let's do it.
Thank you. So I'm here representing a group. The Center for Global Safe Water was founded by Jean Gangarosa, who you met. And our consortium includes 2 universities, Emory University and Georgia Tech University, as well as CARE and the Carter Center and the CDC. And so we illustrate the partnerships that Dr. Koplan just mentioned a few moments ago, because these institutions have very complementary skills, but we have a shared vision. Our vision, our goal is providing safe water and safe sanitation for people all over the world, especially vulnerable populations. So we feel that an alliance like this of Atlanta-based institutions is a powerful way to tackle this. So what can a university do? What role does a university play in an alliance like this? Because usually we're not the people out there digging wells or building latrines. Our job is threefold. One is that we train people, we build capacity as professors, we teach courses, we have hands-on training in country, we have these global field experiences sponsored by the Gangarosas and others, because we have many students who are eager to learn this area of expertise. So training and capacity building is one of our main roles. We also do monitoring and evaluation of programs, and I think that we'll be hearing more about that later. But the third thing that we do is we do research, applied research. And you may wonder, what's the role for research in water and sanitation? Is it really that difficult to drill a well or to build a latrine? But if it was so easy, why do we have a water and sanitation crisis now? Why do we have 40% of the world's population without safe sanitation and about 800 million people around the world without improved water? So there are still a lot of things that we need to learn in this area, and our role as researchers is to build the evidence base so that decision makers, implementers have good information on which to base their decisions, and that they use that information for their decisions, that they make evidence-based decisions. We call it data for decision making. And I think I'm going to stop at that for now, but maybe I can give you some examples of our work later on.
Great. Thank you, Professor Moe. David, you maybe give some introductory comments, and
Sure.
We'll come back to the one magic thing that you
Well,
want to
good. That gives me some time to think about it.
Okay.
I actually had a few slides I'd like to show. Would that be okay?
Yep. Remember that better pull the mics close to you because it makes a big difference.
Okay. I don't know if it'd be better to do it up from there, or
You're welcome to.
that'd be great if I could. Thank you very much. Can everybody hear me? Great, thank you. Well, it's really a pleasure to be here, and I'd like to spend a few minutes talking about soil-transmitted helminths, which is what I've been asked to speak about, and water, sanitation, and hygiene. I'd like to begin with this word transforming and transformation. Now, transformation is a strong word. It refers not only to just change, but profound and fundamental change. I've come to think of transformation in 3 stages. First, we have to be open to the possibility of radical change. Second, there's often a transformative event, sudden and life-changing. And finally, unless that is consolidated or sustained, the transformative event doesn't necessarily lead to a sustained or transformed life. So with those initial thoughts on transformation, I'd like to introduce you to our culprits. 3 species or groups of worms, roundworm, whipworm, and hookworm, that collectively are known as soil-transmitted helminths. The adult worms live in the intestines and release millions of fertilized eggs, which are passed in the stool. And where sanitation is inadequate, the environment becomes contaminated, and infection is spread either by ingesting the eggs or in the case of hookworm, by walking barefoot on contaminated soil. S.T.H. disease is related to the number of worms or the intensity of infection. And it's characterized by anemia, malnutrition, and impaired growth. The worms usually don't cause death, as some of the other diseases we'll hear about today, but rather a chronic drain of energy and nutrients, the kind of suffering that Emory theologian Wendy Farley calls the suffering of unrealized potential. So the primary WHO strategy to address STH is periodic mass treatment for the 615 million children school age who are at risk. Johnson & Johnson and GlaxoSmithKline have donated up to 600 million doses of deworming drugs every year to countries that need them. And where I work, Children Without Worms, we try to facilitate these donations. The benefits of deworming include improvements in growth and nutrition, school attendance, even cognitive function, and long-term economic earnings. Why focus on school-age children? STH infections aren't limited to this group, but as this graph shows, the worm burden or load is often greatest in school-age children, shown in the blue bars here. School-age children are in a period of rapid growth and development, and schools represent a very low-cost platform for drug delivery. But with drug treatment alone, we can expect reinfection. This green dotted line shows the rapid decrease in worm burden with treatment, but then the also increase after treatment almost to pre-treatment levels within 6 months to a year. So sanitation and hygiene are required to interrupt transmission. If we return to our 3 stages of transformation, water, sanitation, and hygiene sustain and consolidate the gains made possible through drug treatment. This would be the 3rd stage of transformation. But they're also very important in primary prevention, as we've heard, and they can play the role of the transformative event. A recent review showed that access to sanitation facilities, even in the absence of drug treatment, was associated with a 50% decrease in STH prevalence. And a similar systemic review being done here at Emory shows the same effect for access to improved water. I'd like to thank student here, Eric Strunz, for sneaking me this preview of their very exciting data. I'd like to close my remarks with a question. We talk about transformed lives. Who's being transformed by the impact of water, sanitation, and health on STH? Certainly the individual children. Their lives are transformed through the alleviation of suffering that is often subtle and hidden, but measurable. In turn, entire communities are being transformed. And finally, I'd like to invite all of us here to consider how we are being transformed through the privilege of engaging in this important, challenging work. Thank you.
Thanks, David.
Thank you.
Rob, you want to speak from there, up here?
Take the podium, thank you. Well, good afternoon. It is a pleasure to join you. And I guess this is one of many circles coming around again. I am Deputy Director now of a division dealing with enteric disease. That division is the direct descendant of a small branch at CDC that Gene Gangarosa directed himself back in the 70s. So we share those common roots, Gene, and it's a pleasure to join you and Rose again. My answer to your question, Jeff, is schools. And something can happen in schools that transforms the next generation. And when we can have small, simple systems that can be dropped into schools that provide that the children themselves can operate. I mean, this can be part of science class, to provide clean water, to have an operating latrine and a hand washing facility. The kids can transform themselves. They can learn a lot. They will learn more because they won't be sick as much. So that would be my answer. We often take safe drinking water for granted in this country because it's been more than 100 years that we separated our sewage from our drinking water and brought treated piped water into almost every home. But in many countries around the world, diseases like epidemic cholera and typhoid are still rampant because of contaminated drinking water, and every year an estimated 800,000 children die from diarrheal illnesses, most of that from unsafe water and poor sanitation. Now, their drinking water can be made safe and free of microbes, at least most microbes. The definitive answer is similar to what we've done in this country, the safe piped water and sewage treatments, but that's a long-term solution that requires large amounts of capital and political will, and does not happen overnight. There are also, we've learned, simple and practical ways to approach the problem in the short term, and solutions that empower people to make their own water safer, and that can start communities down the road towards the long-term solution as they learn the benefits of safe water and hygiene and sanitation. I learned this was possible in Peru when in 1991 I was part of a team dealing with epidemic cholera that had suddenly arrived. And as we were going through the very poor parts of several cities in Trujillo, visiting people's homes, trying to understand how transmission was occurring. A woman, a community group was accompanying us. It was the Mothers Club, the Club de Madres. And the director of the Club de Madres said, well, look at you guys, you're coming right into our homes, you're talking to us. Aren't you afraid you're going to get cholera? These are the cholera patients' homes. And we said, no, we're not afraid. And I said, oh, you're vaccinated. No, we don't vaccinate, no. We just simply, back at the hotel, we take water, we put it in a plastic container, we drop in a little, that iodine is what we were using, and the water's perfectly safe, and we never get cholera. And there was a moment of silence, and she looked at us, and she said, we could do that too. And that was, for us, the genesis of the point of use water treatment. Intermediate, short-term intervention, but it's something, it's that simple. Treating water in their own home with a few drops of a chlorine solution can really reduce the risk of illness in the family. And we've shown that repeatedly in many different places around the world. In Kenya, introducing treated water and hand washing in schools showed that we showed that the children, by doing this themselves, can reduce illness and absenteeism even in the teachers, and then they take it home and teach the family members and then the neighbors to do this. Providing safe water and treatment safe water treatment and soap in clinics can encourage an expectant mother to attend prenatal screening and protect the health of their newborn child in Malawi. And in Pakistan, we were able to conduct an intervention trial saying, what happens if we take this group of people with clean water, families, and encourage them to wash their hands, and another group of people, families, very similar families, and we can encourage them, but we're not going to give them the soap, and we'll give them pencils and paper for their kids for school, and then watch the families, and diarrhea rates, pneumonia rates, and skin infection rates were half in the families that got the soap and that washed their hands. We went back to them 5 years later, and those kids in those families that had had less illness and more hand washing were 6 months ahead of the other kids in their intellectual development. It was amazing. I mean, and it was a very simple intervention with lifelong impact. But it's important to remember that even in the United States, there's still challenges, and it is truly a global problem. We cannot just take safe water for granted even here. 200,000 times a year, including sometimes in DeKalb County, the water pressure drops in a neighborhood or a town or a city, and people are warned to boil their water. That's because those 100-year-old pipes and those aging treatment systems are wearing out, they're breaking. Our infrastructure needs a lot of maintenance and repair. Those who swim in pools depend on someone to keep that water clean and safe. But there's still no real standards for training them or for what sort of treatment should be required, and it varies all over the place. And there are plenty of outbreaks and illnesses from our recreational water. And there's some pathogens that aren't even affected by the chlorine we use, and so chlorine by itself is not enough. The water systems and cooling towers of modern buildings now are a new ecosystem that some water-loving pathogens can thrive in, like Legionella. And the natural waters we swim in, the lakes, rivers, and streams, can be contaminated. And one dangerous amoeba particularly thrives in warm ponds in the summer. And on rare occasions, if the water goes up someone's nose, it can invade them and kill them. So in the developing world, where nearly 1 billion lack access to improved water sources, there's an enormous need for local empowerment and short-term solution to make water safer now. And even in this country, 100 years after the water pipes and sewer systems made cholera and typhoid fever go away, waterborne disease continues to challenge the public health. It's going to be everywhere. There's a requirement for multidisciplinary solutions. As a first step, it's critical for the health departments, the ministries of health, and the water departments, or the environment and sanitation ministries, to talk with each other about what can be done. And the first step along this way begins when a group of people decide their water's making them sick, and there's something they can do about it, like the director of the Club de Madres in Trujillo saying, well, we can do that. Thank you.
Thank you, Rob. Lourdes is going to present the perennial do translation from there, or do you want to?
Muy buenas tardes con todas y todos. Disculpen que mi inglés es muy malo y yo prefiero hablar en español.
Good afternoon, everybody. I'm very sorry, my English is not the best one, so I'll prefer to speak in English.
Como verán, tal vez respondiendo a la pregunta de qué es lo que pediríamos en los próximos 10 años, yo quisiera proponer comprometer el poder político con el tema de agua y saneamiento.
Answering to the question that was posed at the beginning, what I will bring is that we need to really secure the political will to address the issues of water and sanitation.
Por lo general, en los países y también en el mío, el saneamiento está muy desposicionado. Los funcionarios de salud pública son enviados al área de saneamiento casi por castigo y no por honor. Y creo que esto es parte del trabajo de relevar el tema y la importancia del agua y saneamiento transformando vidas.
Unfortunately, in many of our countries, particularly in mine, sanitation is really not a priority, and public officials tend to go into the sanitation department mainly as punishment. And there is a need to elevate the sanitation issue into government and the interests of many partners and governments.
Tengo que empezar comentando que en el Perú hay un rezago importante en agua y saneamiento. Solamente cerca del 40% de las zonas rurales de sierra y selva tienen agua y casi el 21% tiene saneamiento.
There's a significant lack of coverage in Peru on water and sanitation, particularly in the Sierra and Selva, which is the mountainous areas, and then the jungle area of the country. Close to 40, there's only 40% coverage of water in these two regions, and around only 21% in sanitation.
El rezago también es significativo en presupuesto, donde se destina casi solo el 1% para saneamiento, cuando sabemos de que la inversión en saneamiento de $1 repercute como $9 en beneficios sociales y económicos.
This also translates on a significant lack of investments in sanitation, which is now only 1% of government investments, despite the fact that we know that for every $1 invested in sanitation, there's a return of $9.
Nuestra apuesta como CARE es considerar el agua y saneamiento como una apuesta estratégica porque es la puerta de entrada para el desarrollo. Durante los años de trabajo hemos diseñado una serie de modelos de intervención, de metodologías, de tecnologías y habiendo empezado en el lado comunitario, ahora estamos trabajando en otras instancias políticas para comprometer la voluntad y los presupuestos hacia el tema de agua y saneamiento.
CARE's proposal, it's a strategic proposal that looks at sanitation as a critical aspect in development. We have invested a lot on methodologies and different technologies, and despite the fact that we started with a strong community-based approach, we really are looking into elevating and engaging other political levels and other government levels so that we can really make an impact on sanitation.
El modelo de intervención comunitario tiene una serie de elementos que vinculan la infraestructura, la gestión de los servicios, la administración, la operación y el mantenimiento, en menor medida algunas variables ambientales, buscando de hacer un modelo de intervención integral, cuya base de administración es la comunidad. El Perú es un país bien centralizado y el modelo de gestión del agua y saneamiento rural está basado en las comunidades. Sorry.
I apologize, I'm a volunteer here, so I'm really trying to see how I capture all these. It's a community, the focus is on the sanitation approach is at the community level, and we look at infrastructure, we look at the management, we look at operations and maintenance. In Peru is a very centralized country, and despite the fact that it's a very centralized country, sanitation still takes place at the level of the community. So sanitation is it takes place in a decentralized way and is managed by the communities.
Cuando pensamos en agua y saneamiento rural centrado en la comunidad, debemos entender la complejidad de la administración y también reforzar otros niveles del Estado, pasando por los municipios, las provincias, las regiones y el gobierno nacional.
Despite that the management takes place at the community level, we do need to understand of the complexities of supporting this particular management system and understand how funds and different levels of support are channeled through different layers of government, both at the local and regional levels.
Es por eso que el modelo de intervención considera un nivel comunitario donde se hace la obra, la gestión, la operación y mantenimiento, pero también un modelo que involucra a otros actores, entre ellos salud, educación, el gobierno regional, buscando fortalecer sus capacidades en el marco de las exigencias que la ley peruana les pide respecto a agua y saneamiento rural.
While at the community level we work on infrastructure, the management, operations, and maintenance, we really need to take into account the other levels of government engaged with health, education, and how can we strengthen their capacities to support community management of sanitation.
Un principio importantísimo es la subsidiariedad, en el que buscamos de que quien está más cerca al problema busque atenderlo, porque esa es la manera más sostenible de enfrentar el tema de agua y saneamiento rural. Otro elemento es la integralidad de las intervenciones. Quizá estos años de trabajo nos ha enseñado duramente de que mejorar infraestructura no es suficiente y es como querer lograr sostenibilidad cuando tenemos solamente una pata de la mesa y deben ser completadas las otras al nivel mismo que la infraestructura. Es decir, poniendo componentes de infraestructura, de gestión, de administración, operación y mantenimiento y de educación sanitaria y ambiental.
The solutions really need to be, one of the principles that we have is that the solutions really need to be addressed at the local level, but at the same time that needs to be addressed in an integrated way, really looking not only at infrastructure, but as mentioned before, really incorporating the management, the administration, the operations and maintenance of all these facilities and how to engage other actors in an integrated way. One particular analogy that was made is so that we're not building a table with just one leg, but that we actually have a complete structure.
Una muestra de que el gobierno adopta el modelo ha sido la capacidad de inversión del propio gobierno. Desde la cooperación no es posible hacer la magnitud de inversiones que el gobierno debe hacer. En consecuencia, nos hemos concentrado en definir un modelo de intervención, costearlo, analizarlo, sistematizarlo y transferirlo a los gobiernos locales y regionales.
We understand that international cooperation is not the answer, but that really governments need to be aware and willing of the investments that they need to put in place. For that reason, we have focused on really defining what that model should be for governments to follow, what is the cost. We have analyzed those models and we have shared those models with government to build their capacities for them to make investments in the sector.
Como decía, la base para el agua y saneamiento rural son las juntas de agua y parte del modelo es dejarlas completamente empoderadas para su administración, el cobro oportuno de las cuotas y la gestión en general.
As we mentioned before, one important aspect of this model are the juntas de agua, which are the water councils. And it's very critical to be able to empower these councils so that they can manage the infrastructure, that they can collect the fees, and that they can run the operations in a sustainable way.
Un eje transversal para nuestras intervenciones ha sido el enfoque de género, buscando compartir mejor los roles, tanto de participación en el cuidado de los hijos por parte del papá, que muchas veces se desentiende de esta tarea principalmente femenina, pero también buscando que las mujeres participen en aspectos comunitarios, en aspectos que tengan que ver con su voz, con su pensamiento, con su representación.
A very important element of our work is gender and how do we mainstream gender across everything we do. How do we promote shared roles both for mothers and fathers so that fathers can be part of taking care of the children as well as how mothers can engage in local decision making and they can engage on the management of the community.
Sinceramente, no sé si es más difícil llevar a las mujeres hacia la gestión pública o introducir a los hombres a la gestión doméstica.
I'm not sure if it's more difficult to include women on decision making on public management or like it's a play of words that is in Spanish it's a lot better, but it's like I'm not sure if it's better to include women on civic issues management or if it is to bring fathers to the management of children.
También hemos aprendido que las familias rurales, y nuestra experiencia es bastante madura, ha facilitado el agua y saneamiento como a 110.000 familias a lo largo de nuestra vida institucional y nos hemos ido dando cuenta de que la demanda del poblador rural ha ido cambiando. La letrina antes era la opción ofrecida y aceptada, pero ahora son otros los sistemas que son demandados por la población rural. Particularmente son otros los niveles de servicio. Ahora la letrina ya no basta. Es importante para las familias rurales que sean servicios seguros, confortables, que no huelan mal, que sean privados y que valoricen su inversión. Esto muchas veces compite con la disponibilidad del recurso hídrico de la zona, pero hay que llegar a un punto medio entre tecnología, demanda y capacidad de operación de los sistemas.
We have a lot of experience on water and sanitation. We have served 110,000 families, but we have also noticed that the demand has changed. There's not the tradition, especially in rural areas, there are not the traditional latrines anymore. Families are demanding a different type of technology that, and we need to understand how to mediate between the technology, the demand that families have, and the environmental considerations. Families are looking more for comfort, they're looking more for privacy, and they're looking at solutions that don't smell.
La escuela siempre ha sido parte de una apuesta comunitaria en agua y saneamiento y en un trabajo compartido con la escuela y con el sector salud se refuerza el tema de prácticas, se refuerza el tema de lavado de manos y es muy grato cuando una joven asiste a la escuela y completa su secundaria teniendo servicios higiénicos de calidad.
Our work in a school is also very critical, and we try to introduce different types of changes in behavior and practices, like hand washing. It's very satisfactory when we can see children, particularly girls, who have managed to finish school, to finish high school, because they had access to the right type of services in their schools.
En estos años hemos aprendido bastante, hemos envejecido también, pero tenemos muchos desafíos por venir. Particularmente está el hecho de mantener lo aprendido, difundirlo a las instancias nacionales. Por ahora, felizmente, con apoyo de la cooperación suiza, estamos en 13 de las 25 regiones del Perú. Y un desafío pendiente es el trabajo en la selva. La selva es una zona inundable donde tendríamos que diseñar tecnologías que suban y bajen conforme sube y baje el río. No hay otra forma y no hemos encontrado manera ni en el Perú ni en países fronterizos que resuelvan el tema de zonas inundables. Espero encontrar alguna oportunidad de integración de conocimiento en Atlanta para llevar ese conocimiento a nuestro país.
We have learned a lot throughout the years, of course, with many challenges. We're willing to share what we learned, particularly within the country. The Swiss, with the Swiss cooperation support, we have been able to advance a lot, and with them we now have a presence. With their support, we now have a presence in 13 of the 25 regions in Peru. But one of our biggest challenge now is in the jungle, an area that is prone to flood. So we are looking and exploring at different, we're looking for new technologies that can actually raise as the level of the water changes. So we are looking to you for those ideas and those new technologies that we can bring to Peru to the context of the jungle.
Hay algunos temas que quiero dejarlos como desafío. Uno primero es hacer más eficiente nuestros recursos hídricos. En Latinoamérica todavía hay agua, pero hay zonas de mucha escasez y el reto es hacer una gestión integrada de recursos hídricos con la mayor eficiencia del recurso.
One of the challenges and one of the questions that one of the challenges that we have, and one of the things that we would like to continue exploring, is how can we make our water resources more efficient, and how can we work towards a more integrated water resource management.
El escenario futuro no es muy promisorio, va a haber escasez de recursos y también vamos a tener que hacer propuestas que integren una solución transformadora de los conflictos. En el Perú tenemos severos conflictos por el uso del agua y creo que parte de nuestra responsabilidad es mirar tecnología, ingeniería, ciencias sociales para ver cómo logramos brindar servicios seguros y de calidad en escenarios de escasez y de cambio climático. Esperamos que el agua el agua y saneamiento e higiene sean fuentes de paz y desarrollo. Realmente sí confiamos en que transforman vidas, lo hemos visto en el Perú, lo hemos visto en otras latitudes, pero creo que todavía hay que subir cuesta arriba para comprometer los recursos, tanto financieros como técnicos y políticos en el tema. Tengo un video de 4 minutos que sí está en inglés y si hay oportunidad, no hay oportunidad. No hay problema. Sorry, my English is bad.
Just a quick summary at the end. We have to deal with the issues of climate change and drought. Drought and lack of water is an issue that we're facing right now in Peru. And then we need to look at ways in which we can minimize conflict around this important resource. And we really need to be looking at solutions that involve technology. We really need to be looking at the technology sector, engineering sector, social science sectors to see how we can address these future problems. Water shouldn't be a source of conflict, but instead of peace and development, cooperation and development. And we need to ensure how we can bring a wide range of resources in technology, in political will, and also social resources to address these issues.
Ha sido un honor compartir este espacio con maestros de WASH. De verdad es un honor estar en Atlanta, el Centro de Conocimiento para el Mundo, y espero que los desafíos nuestros también sean los suyos.
It's a great pleasure to be here and to share the table with masters on WASH at the table. And it's a pleasure to be in Atlanta, and I'm excited to share these challenges and ideas with all of you.
Thank you.
Thank you, Lourdes. Very interesting material. David, you didn't get a chance to give your one item. We've heard so far suggestions that one breakthrough would be sanitation, one was related to schools, and one was political will. Those are very complementary items as well. So you've had plenty of time now to think through it.
Thank you.
What's your response?
Actually, I think my theme has been raised by some of the previous speakers, which is integration and the common vision and involvement of multiple sectors in addressing what is a very complex issue.
Great, good. We're going to want to make sure there's enough time for folks here to comment and ask questions. One question to consider is what's on the horizon for both international and domestic water and sanitation work? Is there something you see coming up in the next year or two that's going to make a big difference? Rob, you want to try?
Well, we'll see if it makes a difference. One of the issues that we've confronted in our work in this country is the common perception that real waterborne disease is really not a big deal. There's really not that much of it, and it's sort of curiosities more than serious public health problems. So we are engaged in the effort to really estimate how much illness there is and to come up with serious formal estimates of the health burden of water-related diseases in this country, which we don't have right now. And having that number, here is the public health burden, here is what we think we could do about it, is how we'd like to frame the problem in this country. And we hope to have that completed within another year.
David, do you want to do
I would turn it around a little bit and say for the neglected tropical diseases, what will make the biggest difference is joining forces with water sanitation and hygiene sector. Whether we're talking schistosomiasis, soil-transmitted helminths, trachoma, these have drug-related interventions which are just going to be temporary unless we find common cause with water sanitation. So I would turn it around and say for neglected tropical diseases, especially those, involvement of the water sanitation hygiene sector is going to be critical for achieving the goals we want.
That slide you showed of the up and down pattern of infection, treatment, strikes me you must have a high tolerance for frustration to work on that.
You could say that.
Have there been places where a significant breakthrough has been made that ends that cycle, that from which lessons can be learned for other places?
There has been, and that's part of our work at Children Without Worms, is looking at where those breakthroughs are possible. And it's a combination of treatment, improvements in the environment, hygiene education, and probably drug treatment of more than just one segment of the population. That's an area of active inquiry right now, is to look at which combination of those elements are required in different settings to achieve that breakthrough.
Christine?
So I think the biggest thing that's staring us in the face actually is water scarcity. That's the biggest thing on the horizon. So just a few statistics on that. About 1.2 billion people live in areas of water scarcity, and another 1.6 billion people face economic water shortages. But by 2025, it's going to be about 1.8 billion people living in countries with absolute water scarcity, and about 2/3 of the world's population in water-stressed areas. So what are we going to do? Are we going to continue business as usual? I think this is really an area where we need transformative change. And so I'm happy to say that here at Emory, we are trying some new technology. We're recycling water. We are building a new blue house that's going to recycle wastewater and use it for irrigation and also for the cooling towers and the steam plants. We are using stormwater and recycled water to flush toilets in some of the new residence halls, dormitories. I think we really have to think about using water in a different way and be much more respectful and smart about how we use our water, and not be using drinking quality water to move excreta from our houses to a sewage treatment plant and then into the river. I think there are better ways to use our water than as a transport mechanism.
Would that require major re-engineering of households, apartment buildings? The whole water system would then have two grade A water and grade B water, or am I wrong on that?
So some people have proposed that, and there are some communities that are doing that. Some forced by necessity and some forced or opting to be more progressive about having dual water systems. And here on campus, we have parts of our campus where we have dual water systems. So I do think that it's in our future, and that as we work with cities in other parts of the world, that we shouldn't invent them or help them to follow exactly our footsteps. This is a chance for change. This is a chance for smarter technology and doing things differently, and not just recreating some of the patterns that date back to the Victorian era. Those were good in their time and their place, but now we need some different solutions. And that's what I think we can do as a group, with research, with capacity building, with education, and with political will.
Lourdes, in Peru, is there a community that's kind of a model that you've seen a big change in that could be used as a best practice for other parts of Peru?
Sí, les llamamos, hay muchas, particularmente en las zonas donde el proyecto ha intervenido, que son Cusco y Cajamarca, que fueron el origen del modelo. Les llamamos comunidades emblemáticas y se han convertido en una vitrina para demostrar que el modelo tiene impacto, y son las evidencias a donde llevamos a los políticos para que se convenzan de adoptar este modelo. A la pregunta...
We have many communities where the projects have taken place, particularly in Cusco and Cajamarca. These are what we call our signature communities, where we can really demonstrate impact, and these are the communities where we take government officials to showcase what is really possible.
Dejo el video en inglés y en español para que le echen una miradita.
She's leaving the video both in English and Spanish so that everybody can learn more about the project.
Los Objetivos de Desarrollo del Milenio son un compromiso mundial. Creo que hay que agarrarnos de ellos para hacer sentir la investigación con más fuerza, el compromiso político y las promesas hechas al mundo respecto a las metas del milenio. Difícilmente se va a repetir esta oportunidad y creo que es necesario que le pongamos más energía para posicionar el tema de agua y saneamiento y la agenda pendiente.
We really need to be looking at the MDGs. The MDGs are a true global commitment to the issue, and we really need to see how we can leverage the research that is taking place, how we can bring political will and true commitment to positioning water and sanitation in the context of the MDGs so that we can generate additional commitments.
Good. Let's open it up to some questions from everyone's been quietly sitting and absorbing things here. Any movement you'll make, I'll interpret as you're raising your hand. Distinguished questioner right here.
My voice can carry. This is for David Addiss. You mentioned hookworm. One of the first eradication efforts was for hookworm. And the effort focused on the use of shoes, to encourage children to use shoes. Now, I know shoes are expensive, but it's an intervention that can be highly effective. What is your experience? What can you tell us about the intervention for hookworm that might be effective on a long-term basis, sustained?
Thank you, Dr. Gangarosa. Of the three major parasitic worms comprising soil-transmitted helminths, hookworm is the one that's transmitted, as you well know, through walking barefoot on contaminated soil. So certainly shoes would be a very important investment and part of a comprehensive program to control hookworm. One of the things that is challenging in public health is that we often group things together that have a similar intervention. So when mass drug therapy was found to be effective against these three different worms, the same drug, it was seen as a problem that could be treated with drugs. And the other interventions, water, sanitation, hygiene, shoes, in the case of hookworm, got kind of neglected. So part of our challenge is to recognize that these are different organisms. They have points of common transmission that can be addressed in common, but we also need to not forget these other interventions. I agree completely. Shoes are very important, and we need to pay more attention to that.
Just on that note, some time ago, I was working with colleagues in China in the coal mines of Anhui province. And in the mid-50s, they noticed that the workers had very little energy and they all were severely iron deficiency anemic. And it was because they had no sanitation facilities in the mines. And the mines are half a mile underground and then several miles out underground. So when they go down, they stay there for a prolonged period of time. And they were incapable of doing much labor because of their very low hemoglobin counts. Of course, they provided them with plastic sandals. They all developed normal hemoglobins. The work went on, and this is probably at least 40 years of experience with doing this. So it's global health. We can learn from each other in doing these things.
Dr. Koplan, I have a question coming in from Twitter. Someone asks, how can we bridge health silos to create integrated WASH programs across all health and development sectors? For example, policy, research, etc.
Christine, you want to take a shot at that?
That's a great question, and I think it speaks to the power of alliances. And I feel like our center, the people here, we come from many different disciplines, but we share that goal. And I think part of it is sitting around the table, learning each other's vocabulary and this willingness to work together. But it is clearly, as you now, I think, have a greater sense that these are complex problems, they're multidisciplinary, and it does take an alliance of partners to tackle these in an integrated way, as the previous speakers have said.
Any comments on that?
One comment. One of the fascinating things about water is how it connects everybody up. Whether it's a river, and then you have upstream and downstream communities, a lake, and there's everybody around it who has to deal with each other and what they put in the lake, or whether it's a system, a municipal system. One of the critical points to anybody that operates a system is that you usually have one group of people who are extracting the water from a river or a well and perhaps treating it and putting it into the pipes, and then you have everybody else who's drinking the water at the other end of the pipes. And the accountability for what's going on has to be joint and collective. And the way you do that is you decide where to measure and what to measure. And if you measure the water coming out of a well, and you say, that water is just great, my job is done, I put it in the pipes and there we are. Everything's dandy. Without checking to see whether the water is still dandy at the other end of the pipe, where the person actually gets it and may drink it, you're missing half of what can go wrong, or maybe more. And so many systems, and this is true in the developing world, and it's true in Atlanta, so many systems are focused on, okay, the water that we put into a pipe, the water that we put into a system is just fine, job done, without ever looking at what is the other end. And that's the connect between the Ministry of Water, or the Ministry, or the health, the water department, and all the health effects that start at the other end of the pipe. So I think it comes down to deciding collectively, we're going to look at the quality of the water people drink, not just the quality of the water that we put into a pipe.
Please.
Yeah. So I have a sanitation-related question. So I guess related to latrine waste and more about waste reuse. And, you know, what do you do? I mean, we're trying to improve sanitation systems and such, and I think we can do that. We can organize ourselves, and there's certain technologies with new latrines and things like that. But focused on the final waste product, it seems to me that there's this kind of disconnect for what do we do with it? Where does it go? How do we encourage its reuse, if possible, so that it can be sort of a self-sustaining, process that can have its own energy to it. And I just wonder if is there a technological breakthrough that's needed? I don't know that it's composting and agricultural reuse. I think I have a sort of Western mindset that we're all going to bag this up and like put it in Home Depot and people will pay $10 a bag for it or whatever. But I don't think in developing countries there's necessarily that agricultural pressure. I don't know if it's waste to energy reuse, making briquettes or whatever. I'm just kind of interested to see with what ideas you think. Is it a technological breakthrough? Is this any kind of other systemic reorganization that needs to happen to kind of encourage that whole waste reuse process for latrine waste? I don't know, Christine, if that's for you.
Okay, tough question, Vince. Thank you very much. Sure. But I do feel like this is really an area for research, and this is something that the Bill and Melinda Gates Foundation has been pushing. I know this may sound like modern-day alchemy, but I do think that you can turn excreta into energy, like lead into gold. But I think if you look at do I have the wrong analogy?
You can't turn lead into gold.
But that's what the alchemists were trying to do, I thought, the medieval alchemists.
But they didn't do it.
All right, maybe that was an unsuccessful analogy. But I think that there are ways to do this. I mean, we know that it's possible to make biogas, And that's not super high tech, but it does require some organization. And China has been very successful in pushing biogas production at a sort of a local level. I think that actually the link between agriculture could be using excreta for fertilizer, not so much maybe for food, but for crops that could lead to energy. So different types of biofuels, and I think that that's an area where there could be greater research on efficiency, but I think that there's a way to do that, to use the carbon, use the nutrients for that. And I think that there's a real need for more biochemical engineering research that the Gates Foundation is trying to stimulate. So I think that could be very transformative, and I think it's within reach. I don't think it's misplaced alchemy. How about that?
Great, thanks.
Matt, did you have a...
Sure. So I think we think about water and sanitation because of the enteric disease issue, but these are really, to a person on the ground living in sub-Saharan Africa, these are very different things. And I guess my question is, for that person, that mother without access to sanitation or water supply in a rural sub-Saharan African country, whose responsibility is it for her to have water and sanitation? And how can we as researchers, coordinators of drug delivery, US government researchers and policymakers, and even in-country program staff, what is our role in that process with regards to that connection between responsibility and delivery of water and sanitation to that woman?
That's a great question, and obviously a complicated one that goes into several different interesting and overlapping areas about development and assistance and community empowerment. And I don't think it has a simple answer. I think our role is to find those communities where there is a desire, collective desire to make change, and to figure out what is going to help facilitate that change. I don't think every community wants what we have to offer. Some communities have yet to figure out that water itself is an issue. But to find the change and then to help other communities see what it is that can be done. There is something about empowering a community to take on a problem as their own and to own it. That is far more powerful, I think, than anything that can be offered or imposed from outside. I'd like to make one last comment on technology and on water reuse and recycling, and actually this is going to sound like I'm off into outer space, and that's because I am. Those who have read the book Packing for Mars may have some idea of what the biological and human challenges are of planning a 3-year trip of a small community to Mars and back. And one of the greatest constraints on that trip is you only have so much water. And you gotta take along all your food too. And you really can't take showers because everything gets moldy, but you need to somehow be able to clean up. And so that limited supply of water gets used and reused and reused and reused infinitely for 3 years, at least. And our colleagues, very clever engineers at NASA, are actually confronting this problem and confronting it with all the creativity that once got us to the moon. Now, I don't know if we're ever going to get to Mars, but one spin-off of this may be some very interesting technologies that aren't going to weigh very much for recycling and recycling infinitely our waste streams, our water streams, and our food supply.
I once used a locker room that kind of seemed like that 3-year trip to Mars. Please, Lourdes.
Quienes hemos estado en salud pública, pensamos que el motivador principal es la salud pública. Las familias están pensando en felicidad, en autoestima, en dignidad y en valorización de su propiedad. Es otra mirada a un mismo problema.
For us on the ground who come from public health, we think that the main priority of the families are public health, are health. But in reality, the only thing families are thinking of are happiness, self-fulfillment, and increase of value of my property, and that's what they really have on their minds.
Desde esos puntos de vista es más fácil comprometer su corresponsabilidad. Y es así como lo hemos hecho. El político no piensa en agua y saneamiento, piensa en votos. Entonces hay que asegurarle y darle el argumento de por qué el agua y saneamiento le puede dar una reelección si es que hace un buen sistema. Y cada actor tiene un motivador distinto. Eso ha hecho de que participen corresponsablemente ciertamente en una agenda distinta, pero con un impacto común, como es disminución de diarrea vía la provisión de agua y saneamiento, donde el agua es un alimento más, y mejoramiento y reducción de pobreza, que en términos de país nos interesa a todos.
They said in that sense, with the example that I gave of the family, we need to look at the different ways in which we need to engage the different actors. So politicians don't think about water and sanitation. They think about what I can do to get votes. So we need to really create an argument around how WASH and investments on WASH systems can really get you votes. And each actor has a different set of interests. They have a different trigger that get them to act. And what we need to do is we need to see how we can work with the different agendas to reach that common goal. Within reality is how can we increase health, how can we improve health, and how we can really promote poverty, but by addressing those different agendas to get to that common goal.
Excellent. That's actually a very good summary of all of our thoughts today. I think the complexity of the subject has been illuminated by the various presentations and the questions and answers. We've covered a wide range of contributory factors in the need to make progress in WASH overall, but those factors include obviously cultural issues, developmental issues, educational issues, political issues very much, and the solutions probably involve better integration, better looking and seeing the expression, what's the trigger on this, or what's the lever that moves things along, and the multidisciplinary nature, the multi-intervention nature of what needs to be done. But amidst all that, I think there has to be continued effort to make sure it's both one of the Millennium Development Goals, but also that it moves to the more forefront of people's thinking about public health and global health. We have an issue in the United States. We are offering advice to others at a time when we do very little recycling, that we're paying very little attention to climate change, that we use immense amounts more water than most other parts of the world. So part of to be a role model and a leader, you've got to be a role model before you can be a leader. So we've got a lot of action to do on this end too. And some of those solutions may well be applicable to other places in the world, but some of the solutions in the other parts of the world are certainly going to be applicable to us as well, whether it's on that 3-year trip to Mars, or dealing with the expanding Gobi Desert, or dealing with severe water problems in many other parts of the world, as well as the loss of major glaciers that supply water supply in many places. Increasingly, I think security, diplomatic, international disputes will be around water more than we currently see it, even worse than the dispute between Georgia, Florida, and Alabama. We'll have more of these in different places. And so I think the attention of politicians to this will arise more than just public health, but for security and for territorial and economic and other reasons. With that, thank you all for coming and joining us this evening. I know you've all got lots of other things to do, but it was great to have you all here. And thank very much our panel of 5 distinguished participants. And we appreciate your coming from a long distance, Lourdes, and we appreciate your help in making sure that we understood what was going on, and there was a lot contributed here. So, and those of you who came from other parts of town or down the Clifton Road or upstairs, we appreciate that. And of course, we thank the Gangarosas in particular for all they do for this and their constant attention and presence to it, and our colleagues at CARE and CDC and Children Without Worms and Diane Fossey, Gorilla Fund, and all the other folks here who I don't know, but who are all partners with us in this enterprise. Good evening.
Hi, everyone. Just a quick note. As you know from the advertisements, this was, there's actually another panel that's happening in Texas as we speak. The plan was to have a 10-minute break, and then there's a panel on WASH and women going on at Southern Methodist University in Texas that's being hosted by the Bush Institute. And for various reasons, they had to start early. So we're going to join them in a few minutes midway through their panel. If you'd like to stick around and watch that, you're welcome to go use the restroom, go get some refreshments, come back inside. And I wanted to thank our panelists again and just let them know that they each get an Emory mug for their participation, even the ones that work at Emory. All right.
So I think we will come knocking on your door about this, building this consortium, because the links are already there. But how can we make you feel like now you're a part of us? Okay. Because truly the name of the center is Center for Global Safe Water at Emory, not Emory Center. So we're trying to make it be that we're the host, but it's a consortium. So good. You have a daughter. Didn't I meet your daughter ages ago? Must be a pretty tough lady to be able to do that. Surprisingly. Good. All right. Well, I look forward to talking with you some more. Good. Thank you.
To bring half the population along with you. So I'll leave it there.
All right, so a few years ago, I learned that over 1 billion people on our planet don't have something that I've always taken for granted, which is water. And over the past few years, I've been able to launch campaigns using adventure to get people excited about supporting water causes. And I've seen that the excitement is there. People want to see wells. They want to see smiling faces. They want to see that crystal clear water. And I've seen kids bowl for water, dance for water, swim for water. The creativity and imagination is there. What I haven't seen is kids bowl for toilets, swim for toilets, dance for toilets. But research has shown that sanitation is just as important, if not more important, than water. Research has shown that that sanitation alone can reduce water-related deaths by 37.5%. Hand washing alone can reduce water-related deaths by 35%, and finally clean water by 21%. So it needs to be a holistic approach. You can't just say one is the answer, but I definitely see that sanitation is kind of the underdog and needs a little bit more attention than what everyone else might want to see with water.
So thank you. I agree with Catherine, and I agree with you completely, Katie. Sanitation, hygiene, and water in that order is absolutely essential to health. But I think Catherine's also right. When you ask women, they want water first because, as Catherine said, there's a huge opportunity cost related to the amount of time that they spend fetching water. And what I wanted to highlight was that in cities where women do have relatively easier access to water, they're still queuing up at about 2 or 3 in the morning with buckets, which they then leave and then come back at about 5 in the morning and hope that a huge fight doesn't break out in the line where their bucket was. And if they're going out at 3 in the morning to check on their buckets, they hope that they're not going to be attacked for the water that they're carrying back. So I think that, and I've spoken to women in cities who arrange their entire economic lives around the chore of having water. So they can't work far away from their home because they have to be at home when the water gets turned on. They must organize their entire lives for their children's schooling and their cooking and their washing their clothes around when the water will get turned on for the few hours in the day. So what I'd like to say is that, women face a lot of insecurities. Poor women especially face a lot of insecurities. They're not just related to water. They're related to inadequate wages. They're related to food. They're related to family dynamics. They are related to the violence that they have to, gets perpetrated against them. And I think the ability to make them secure in water would really take care of a lot of the associated insecurities that women face. So in that sense, I think that access to water just allows women to be more secure in their entire lives, and not just because it's water, but because it's related to food, and it's related to their livelihoods, and it's related to their health, and it's related to their real personal and physical security. And that's why women and water are just so closely bound together.
Thank you. I think it was highlighted, the Millennium Development Goal, and I would like to concur with the conclusion that was made that the challenges are still there, but the challenges are the greatest for the poorest women. And right now, only 11% of families, women, in the least developed countries have access to water within their house. So the fact is, even with the Millennium Development Goal for water having been stated to have been achieved by 2010, women are still walking to collect water. And of course, the poorest women are walking. I don't think you can underestimate the importance of sanitation any less important than water. Water, sanitation, hygiene, all three of them are pivotal. They're pivotal because, of course, most of the pathogens are contained in human excreta, and the most dangerous pathogens are in the excreta of children. So finding cost-effective and simple solutions is still a major challenge. And when 2.5 billion now, there's an increase of 100 million that had access over the past 10 years is still not sufficient. Of course, bearing in mind population growth, there has been some progress, but certainly not sufficient with all of the health challenges that were discussed by the Emory panel this morning in terms of diarrheal disease, in terms of helminth infections, the fact that more than 40 million pregnant women suffer from hookworm infection. which causes anemia, which obviously exacerbates the and causes problems with the development of the child. And then, of course, recent research, which is looking too at the fact of malabsorption as a result of continuous episodes of diarrhea, helminth infections, other infections that obviously lead to undernutrition and impact on stunting within the child, and also impact on the ability of the child to be able to learn at school. So also the focus on looking at water and sanitation as integral to efforts in both global health and in education is essentially important. When less than 50% of schools have adequate access to water and only 40% have adequate sanitation facilities. And that ability to learn from an early age these practices and to obviously ensure that less infection, less disease is prevalent among children is why it's essentially pivotal to have WASH as part of global health programs and as part of education programs, not just primary, also secondary, for girls to ensure that they have access to facilities so that it doesn't deter them from attending school, obviously, as they're reaching adolescence for reasons of privacy and convenience.
Gary, did you have anything to add?
I can't disagree with anything that was said, but I will say two things. One is we've heard a lot about neglected tropical diseases and how they're interrelated with these issues. I used to chair an organization called Deworm the World, which is school-based deworming. And it turns out that it's one of the most cost-effective ways to increase primary school enrollment. For about 10 cents a kid per year, enrollment in primary education increases by 1/3. So it's a twofer. Not only is it related to these issues, actually a threefer. Not only is it related to water and sanitation, but it's also related to health and to school enrollment. I, of course, wanted to rename it Wipe Out Worms. Wow. But I say that with a reason, which is we need to bring greater awareness to these issues, and good marketing is as applicable to these issues as it is to any corporation out there. The final thing that I would say is that when I was running the Clinton-Bush Haiti Fund, the presidents decided to focus it primarily on job creation and economic opportunity, because their view was that for reconstruction to be successful, after the billions of dollars of donor money is spent, both private donor money and official donor assistance, the success and sustainability of reconstruction would depend upon one and only one thing. And that's what Haiti has never had. Inclusive, vibrant, competitive, environmentally conscious private sector, because that's the gift that keeps on giving. And so we didn't do water. And when there was a cholera outbreak, I was asked why we weren't doing more on cholera. And my response was, first of all, we were doing some, but there were other organizations out there much better funded than we were and much more knowledgeable than we were to control the cholera outbreak. And we were funding some of them. But most importantly, my comment was that cholera, like water, lack of water scarcity, lack of sanitation, is a symptom. It's a symptom of poverty. And as you just pointed out, the women who suffer most are the poorest. And what we really need to do is address the underlying cause, which is poverty, and apply our know-how to that. I'm not saying to ignore the symptoms. We have to address those, but we have to recognize where they come from. And that's the underlying issue of poverty in this world. And that's why I think we need to start thinking about these issues as an opportunity, not merely as a challenge or a burden.
Agreed. I have been flagged that the feed from Emory has been restored and that we are now back together, but they've asked me to reintroduce the panel very briefly, so thank you, SMU, for your patience. I'll just do a real brief. So We have Gary Edson from the Bush Institute, Vanessa Tobin from Catholic Relief Services, Dr. Tanvi Nagpal from the Science School at Johns Hopkins University, Katie Spots, world-renowned adventurer, and Catherine Bliss, Dr. Catherine Bliss of CSIS. So the next question I wanted to direct at you, Dr. Bliss. Since we are in an academic institution and you have quite a career working in various academia, especially with the University WASH Consortium, which is an organization that my organization is closely linked with, and we're helping kind of reform a little bit. What are the roles of the U.S. and global academic institutions in addressing this nexus of WASH and women?
Thanks. The University WASH Consortium, which we used to call WASH U, but then that was a little too close to some college names, so University WASH Consortium doesn't roll off your tongue quite the same way. We launched that in November of 2009, and at the time, it really had three broad goals. One was to raise the profile of U.S. universities doing international work on water, sanitation, and hygiene issues. One was to identify opportunities for U.S. university professionals, so faculty, staff, graduate students, and others who were working on WASH issues, to contribute to activities to meet the international water and sanitation objectives, like those contained in the Millennium Development Goals, and also to facilitate the contribution of U.S. universities to U.S. foreign assistance programs focused on water, sanitation, and hygiene. And in 2009, this was about 4 years after the passage of the Water for the Poor Act, the Senator Paul Simon Water for the Poor Act, which had really increased the profile, raised the profile of water within U.S. foreign policy. And so we felt like it was a good time to do that. We felt that a consortium of universities and university professionals was necessary because many people observed that faculty and staff working on, at least from the US, working on WASH issues really came from very diverse disciplines. There was microbiology, public health, engineering, hydrology, just to name a few. And those were among the different faculty who were involved or who became kind of part of the core group of the consortium itself. And we saw that at the broad global and international level, they didn't necessarily interact because they go to different conferences, they publish in different journals, and they compete, in some ways they compete for funding sources. And so there wasn't a natural reason that all of these different disciplines, even though they were working on similar issues, might come together. And so we found that on some campuses, people might be working in the same country on some of the same issues and not even be aware of each other's work. So one of the things that we started out by trying to do was to say, what do US universities do? How do U.S. universities contribute to WASH issues? And Professor Christine Moe at Emory already outlined some of these, and Professor Moe was one of the key, has been one of the key members of the WASH Consortium. But she and a team, working on the issue really came up with at least 4 ways in which U.S. university professionals contribute. One is by carrying out and publishing original research. Another is by training students, basically teaching, developing the pedagogical methods for training on WASH issues, training the next generation of WASH professionals here in the US. Another is contributing to the ongoing development or ongoing professional development of the WASH community in the US and internationally through engagement in field research and engagement with local researchers and colleagues at universities around the world. And then finally, another area was developing evidence-based programs to assess program success and outcomes. And this was something that we felt could be particularly useful in contributing to some of the foreign assistance programs. University researchers were neutral parties who could really carry out monitoring and evaluation and help contribute to an understanding of program success. So, in terms of thinking about the ways in which university researchers and teachers can help resolve some of the challenges associated between women and water and sanitation and hygiene, I think one of the first ways is to carry out additional original research on the ways in which the lack of access to water and sanitation negatively affects women in specific contexts, both at the country level and at the local level. And I say this in specific contexts because there's a tendency, I think, among the policy and advocacy community to kind of rely on a fixed set of anecdotes about women in WASH. And these are really compelling stories. You've heard many of the numbers here, 10 hours, 45 pounds, however many days that people are losing because of work. These are compelling estimates and averages. But at the end, I think we need very specific information, not only about what the economic, social, and political impacts are in countries and at the local level, but I think that university researchers can also go beyond these general numbers and provide a great deal more evidence to support the argument that investing in water and sanitation is good for women and good for the economy and society. One of the things I mentioned before was that the university consortium so far has really kind of galvanized microbiologists, public health, engineering, and hydrology. I think if more social scientists became involved, we could, begin to galvanize more research around questions, why is collecting water, which can arguably be viewed as a fairly dangerous enterprise based on some of the discussion we've had here, seen as an appropriately female task? Who in the household decides that it is the girl child that's going to go gather water? Who benefits from that decision? What's the process by which that decision is made? This is, again, drawing on anthropology or sociology, but how do households, the parents, the mother and the father, decide to take girls out of school when they hit puberty because of sanitation and safety concerns? Who makes the decision? Is it the father because he wants to protect the honor of the house and its inhabitants? Is it the mother because she wants her daughter to be safe, or does the mother want the daughter to go to school? Or what's the power relationship kind of driving that decision making? I think, looking at the political and economic aspects, you could think about ways to shift some of the incentives so that girls' education becomes more of a priority. I'll just end with a discussion, about university professionals contributing with respect to teaching and contributing to the professional development and leadership potential of the next generation of WASH professionals, including women. I think a lot of US universities have experience creating programs to attract women to engineering, the sciences, and other technical fields, and I think this can be shared with counterparts overseas. And there's also, finally, the potential for understanding the ways of engaging women in entrepreneurial practices. There's, we've talked a bit this afternoon about the role of women and kiosks kind of at the very local level, but looking at the links between engineering and technical innovation and entrepreneurship, what is the potential for generating a greater participation, by women in marketing of new technologies and solutions? So I think US universities have a lot to contribute, from research, teaching, understanding the rationale behind some of the decision making, and really kind of pushing forward on technology and innovation.
Now, Dr. Nagpal, not to put you on the spot, but I saw some vigorous agreement. Would you like to add anything or underscore?
I just wanted to say that I couldn't agree more in terms of interdisciplinary learning that, and teaching. Universities are set up to reward excellence in particular fields. And while all universities talk about interdisciplinary learning, that's not how professors get tenure. So, so it's just important to remember that when professors go outside sort of their areas of expertise and take those steps, they need to be supported by really, important dynamic, understanding universities. And I think that that's, it's easier said than done, and it takes a long time to change that. I'm a political scientist who now works on water. I mean, it was through a very funny series of coincidences that I ended up here. But I knew that I would be pathetic in a political science department, So I think that that's how our students need to learn, but we are not set up to teach them like that. I think it happens more and more now at the master's level. I think there's a global water program at Bloomberg School. The London School of Economics has its own water program now at the master's level. I mean, there are water programs that are being set up that are now attracting faculty from everywhere, but they're all faculty in their particular disciplines. They're not thinking in an interdisciplinary way. But here's a wonderful opportunity to do that and to maybe foster research among where faculty members from different fields can come together and work on the same research problem. And I think then that would truly, truly engender that kind of interdisciplinary work. Yeah.
Great. So I'd like to transition now from higher education to primary and secondary education with Ms. Tobin and her expertise after 34 years at UNICEF, one of the vanguards in that area. And then Katie, I know that you have some experience in this topic as well, so if you have a response to after Vanessa.
A lot of emphasis over the past 10 years has shifted to really looking at behaviors in young children and focusing on schools. So there has been, since 2008, a major initiative, a focus of WASH on schools. It's mobilized many partners. It's been obviously generated much interest and support. But I would say to date, the results have been mixed in terms of success. I think there's been a great emphasis in many countries now in really generating support for water and sanitation facilities at schools, in really initiating action with children and others. But there has not been three essential elements that need to be there in order for the initiative to really gel within countries and to receive the support it needs. And I'd say the first was governance. That this isn't if it's at schools, it has to be led through education. And education needs to put their support and might behind it. In the Philippines, the Minister of Education took the lead. He was the person who mobilized support and then ensured that resources were available at local level. The resources were already there. It was a case of rebudgeting to ensure that funding was essentially available. And then monitoring was also built into the initiative by education to support it rather than being seen as a water and sanitation initiative. The second element, of course, was that political support that came directly from the minister, that came directly from district level officials, that very much supported it and ensured that it was incorporated effectively. And in countries where it's worked, that political support has been essential. And then the third element, which obviously is always the one that is the most difficult, is the financing. But that can also be done innovatively. It doesn't have to be expensive. It can be suitable technologies, but it must be able to be cleaned and to be able to be maintained. So finding those solutions and finding the budgets that can be available, and essentially also when schools are being constructed or facilities are being reconstructed and budgeting is provided, the designs, the types of facilities that are provided are not appropriate, and ensuring that those are appropriate is essentially important. So I would say that those three elements being built into programs to support WASH in schools is essential, and I think there would be more success.
Katie, did you have any personal experience? Or?
Well, I have designated funds to many different countries as a result of the funds that were raised from the row, but I only had a chance to visit one of the projects, which was in Kenya, and from visiting that project, I was really impressed by the way that they got the kids involved, and they had clubs after school. They even did dances and made it so it was fun and exciting for them to be a part of that. And I've also seen how by working with schools, especially connecting water with schools here in the States, it's sometimes hard to relate to these issues when we have water in abundance, and I've seen how the gap is bridged because they are in that same school surrounding or environment.
I just want to add something from a completely different perspective, which is schools here. I'm a big believer in kid power. And that came out of, especially out of my experience in helping to found Malaria No More. When we came up with the equation, $10 buys one bed net, saves a life, we inadvertently empowered everybody from the 6-year-old with a lemonade stand to the CEO of the largest corporation in the world to save a life. And that mobilized kids tremendously. And I remember my daughter was about 7 at the time, and she asked me lots of questions about it. She said, well, you know, are the holes in the bed net big enough to let oxygen through? And I said, yes, the kid can breathe. But they're small enough not to let the mosquitoes through. And I said, yes. And she thought about it for a while, and she grabbed a book from me that Howard Buffett had sent, a portfolio of his photographs in Africa, some of which are really difficult to look at. And then about 2 weeks later, I came home one day, and she came bounding down the stairs and with a little envelope decorated, of course, with flowers. And inside was a $10 bill. And I thought to myself, she's got it. She got it. And then it turns out, when I asked her where she got the $10, she said, from my tutor. She not only had so learned the ask, she was able to weasel the $10 out of her tutor. My only point is the Urban Innovation Institute that you all are creating here for kids is as important to solving these problems, awareness of them, to solving the problems, to applying the solutions, to make it really part of their lives is equally as important as what we do on the other side of the world in these poor communities.
Wonderful. Vanessa brought up the issue of governance, and we certainly have some political and policy experts on the panel. Gary, can you talk a little bit about the experience of creating PEPFAR? I think those of us in the international development space are in awe of how far it's going, and I think we're all constantly, especially in the WASH space, looking for opportunities to work similarly as far as big institutional apparatus that's answering a large call. And even if you can talk about how the Bush Institute is now utilizing PEPFAR as well to push issues of breast and cervical cancer, I'd really love to hear any lessons that you can provide us.
The most important lesson is to aim high, think big. I truly believe that one of the most overlooked and underemphasized aspects of PEPFAR was when the president put out the goals. At the time there were, it's hard to believe now, at the time there were only 50,000 people in all of Africa on antiretrovirals. So he announces this initiative, and he says that within 5 years we're going to put 10 million people on antiretrovirals, we're going to prevent 2 million infections, and we're going to care for 10 million orphans. Or I think it was 7 million on antiretrovirals. Unheard of. And he said, and we debated this greatly about what the goal was, and we finally came up, because the scientists and academics were all concerned that we were going to put a goal out there that wasn't accurate. We said, we need to turn the tide on this pandemic. It was by putting those stakes in the ground and by setting the goal so high that it actually galvanized action at all levels of government, organizations throughout the world, et cetera. We often aim too low, I think, in a lot of these initiatives. I think it was a brave and courageous thing to do. I defy you to find another president who put out there such ambitious goals and said, this is the yardstick by which you're going to judge me. A couple of other lessons from PEPFAR were, first of all, that the key to PEPFAR was, A, breaking all the rules. We did it not through an interagency bureaucratic process, but through a small SWAT team, which is not the way to do business in Washington, but it is the way to get something done. Secondly, we, in putting PEPFAR together, we focused it. I remember coming into the president with the original PEPFAR plan, which covered many more countries. The CIA had just come out with a study that was called the Next Wave, Russia, India, China, et cetera. And the president said, no, those countries have the wherewithal, they just don't have the will. We need to focus this initiative on the most afflicted and the poorest countries and show the world that we, in fact, can turn the tide. I, of course, came out of that meeting pistol-whipped and went back to the drawing board, and that's how we came up with a limited number of countries initially, 15. Now it's, what, double that. The final point that I would make about PEPFAR is that we understood as we went along that while this was a government-funded initiative, we needed to bring into play all of the sectors, the nonprofit sector, government, and business. And in fact, PEPFAR had an entire section on public-private partnerships. And I happen to think that what is occurring now is that those three sectors are coming together into a fourth sector. These new models that I was talking about in my remarks will often be a collection of nonprofit expertise, private sector capital, and government assistance that leverages that capital. And that fourth sector is going to be dedicated to finding profitable solutions to the biggest challenges we face. And in fact, PEPFAR, we're finding, given the investment in it, has spawned a whole slew of private sector initiatives. The two Kenyan entrepreneurs that developed the franchised pharmacy operation, the young woman in Uganda that developed a door-to-door Avon-like business selling basic medical supplies. Those are the kinds of unintended consequences, but good ones, that we found from PEPFAR. And finally, we discovered that PEPFAR really began to build the backbone of health systems in a lot of these countries. And on that backbone, we discovered we could layer additional interventions, whether it was measles vaccines, HIV testing, water and hygiene education, et cetera. That too was something unforeseen at the time. So I think it was the biggest lesson, though, that I would take from it is aim high. You attract attention, you galvanize resources, you inspire young people, and you bring different groups together in a common cause.
Go ahead.
Two areas where there has been, I think, great breakthroughs, particularly on focus on schools and on girls, has been the focus on hand washing and the focus on household water treatment. And that's where the private sector came in. That's where companies like Unilever, Procter & Gamble, others have come to the table. They've shown a great interest, and it's mobilized schools. There's been great success stories in India on this, of household water treatment and school water treatment that's been going on with private sector support, small Indian companies that have got engaged and supporting it, and in other countries as well. And I think that this is something that needs to be nurtured and supported. It's working as well in the Philippines. Unilever is now taking it into a number of countries. So this is, as rightly stated, I think engaging the private sector more within the water and sanitation sector more effectively. It's been done, I think, quite successfully now on the hand washing side and with the household water treatment side, but obviously it needs to be expanded and much more energy and momentum engaged.
That's a perfect segue.
And I just wanted to say that, and two places where the private sector could come in and still engage and would have a huge impact on women. One is in just menstrual management, which, you know, girls do not have access to menstrual management supplies in a lot of very poor places. And just looking at the large study that was done on school wash in Kenya, there's a lot of data that's come out of it. It was done at Emory. On other sort of just materials that you need to you know, clean yourself in bathrooms. And I hate to say this in such great detail. I don't know. I mean, I guess it's a water and sanitation forum, so I can say this. But, you know, a lot of toilets get clogged because children are using just about anything they can to clean themselves. You know, so we need to think about these things, and the private sector also needs to figure out how to be able to create those kinds of products profitably for poor children in these countries, because they're the ones who don't have access to them. And then the other place where I think we need to look very carefully, and I think Christine alluded to this in the prior panel that was happening at Emory, was that there is this nexus between sort of on-site sanitation and, energy loops, whether that's for, energy for, in terms of fertilizer, or it's energy in terms of gas. I don't know to what extent that's going to take off, but definitely look at off-grid solutions for sanitation, whether that's decentralized wastewater treatment afterwards, or just sewage treatment. I think that that's another huge opportunity, and that's something that engineering students should get excited about, because small cities and big cities are all going to be looking for sanitation solutions in the coming years. But I would also really entreat people to look more carefully at menstrual management products for girls and bathroom supplies for poor children. So.
Actually, I'd like to stay with you for just a second, Dr. Nagpal.
Okay.
We talked before this panel about sustainability issues, and you just brought up a whole host of different interventions. And can you expand a little bit more on what's going to sustain that work, and maybe talk about the issue of sustainability and why we talk about it so much these days?
Yeah, it's kind of a interesting thing. Why should we talk about sustainability? It seems so obvious, Yet I think that the water and sanitation sector, especially in the United States, has been incredibly risk averse in terms of just admitting that something didn't work, and has continued to do the same things over and over again with the hope that this time it is going to work with minor changes around the edges. But we know that a huge number of rural water projects fail, and the whole rural water landscape is dotted with failures, as it is with successes. I'm not going to poo-poo that. But I think that we need to move past sort of doing the same thing again and again and hoping for a different response. And I think that's when the idea of sort of sustainability in terms of the sustainability of the service came about. But I'd like to go beyond that and talk about other sustainability. I mean, sustainability in terms of not just finance, but also environmental sustainability. The ability of infrastructure to deliver the same kind of service for which it was intended, for it to be affordable over a long time, for it to be equitable over a long time, for it to be affordable, for it to be reliable. And all of those things have to be taken into account when we're looking at the sustainability of a particular service. And I think we've been terrible at doing that. I think by and large, we've created infrastructure and walked away from it and assumed that it will be sustainable, and nothing is sustainable without an infusion of resources. And I think Vanessa was referring to this. I mean, financial sustainability for school interventions is a huge issue. You walk away from the school, and 3 months later, there is no soap for hand washing. And sure, when they had the soap and you taught them how to wash their hands, they learned. But 3 months later, there's no soap. So, I mean, the sustainability of these interventions is important, not just because they fail to deliver the goods that we promised they would deliver, but also because every time a project or a program fails to deliver those goods, it creates a very vicious cycle of mistrust. And it's, as if, well, we never expected it to work, and so it's not working, so whatever. The next one will come along. Or not holding your service delivery professional to a higher standard because you just don't expect them to deliver the service anymore. So I think that, these sort of raising your game is important. Not just the bare minimum, but just really raising the game.
Did anyone else have thoughts on that?
I've said this for years, and Tanvi's heard me say it, I think. I'd love, the holy grail of global development is sustainability and replicability. I'd love to do away with both words. They mean so many different things to so many different people. The bottom line is the only sustainable solution, the only truly sustainable solution for anything on the face of the earth is one that's self-funding. That means a business that turns a profit or at least returns capital. And until we start finding those solutions, we're going to be dependent upon fickle and dwindling donor capital. And that's not sustainability. And that's not how it should be defined. And replicability is the other holy grail. I mean, what works in Kenya may not work in Nicaragua, and we shouldn't think so. You know, the only degree that I have that did me any good is my degree in anthropology. And it taught me to beware of those that claim that they've got replicable solutions. We need to look carefully at the solutions in context before we declare them replicable. Please. And scalable.
About 25 years ago, we were building water supply systems in India, Nepal. At that time, we gave assistance through one of the organizations I was working with for local production in India of pipes, of pumps. And at that point, the cost of the pumps and the parts was about 3-4 times the cost in Europe and in the States. We worked with them, a lot of work went on, a lot of organizations, a lot of people work with them. Now the cheapest pumps, the cheapest pipes, they come from India. They're the most highly competitive of anywhere. The same thing, and this is the major issue too, that within many countries within sub-Saharan Africa, pumps, pipes, parts, they need to be produced. The cost will come down if support is provided and assistance is given. And when there's a plethora of different technologies going in, very difficult to maintain, very difficult to get spare parts out, and very difficult then to get people trained when there's like 20 different pumps in a country. So that energy and that effort that went into India, went into various countries, needs to be going into sub-Saharan Africa, because that's where the breakdown rates are. They're not in Asia, they're in sub-Saharan Africa. So with that energy and attention, if that was coming from the agencies and they were giving that support, costs will come down, systems will break down less frequently, people will buy the parts and spares they need, and they will repair them.
Catherine also wanted to.
Yeah, I just wanted to say, something quickly, about the potential role of middle-income countries in all of this. Gary talked earlier in his remarks about, this shift from the idea of donor-recipient countries to one of partnership. We've also talked about the idea of the private sector. In recent years, many of the middle-income countries, as they have, increased their own economic potential, have become engaged on global health and global development issues. And in many ways, they see this not as, a vertical relationship as much of the world has moved away from, but they really frame this in a lot of ways as South-South or horizontal, kind of global South to global South. And it may be that sharing those experiences across countries, many middle-income countries still face extreme inequality even within their own borders, but have grappled with a lot of these challenges